Hi, I'm Christina, the nurse practitioner here at Eternity Wellness, and today I'm going to talk about microneedling, which is one of my favorite procedures to perform and to receive. Microneedling facials are highly effective in creating smoother, firmer skin with even tone and texture. Microneedling can also revise scars, acne scars, C-section scars, other surgical scars. We can also use microneedling to improve the appearance of fine lines and wrinkles. Another reason people use microneedling is to improve the appearance of their pore size and to lift hyperpigmented areas. But our microneedling device isn't just used for the face. We can also use our device to remove tattoos, to improve hair growth when we add PRP, and to improve the appearance of cellulite or stretch marks on the body. Today I'm going to take you step by step through the microneedling process so you can see just how comfortable and easy the procedure is here at Eternity Wellness. So we always start with numbing the patient with prescription strength topical numbing cream, and we leave it on for a minimum of 30 minutes. And so most people, if they didn't know that there were needles in this device, they probably wouldn't know, because a lot of people say it just kind of feels like a cat's tongue or like a light sandpaper, and some people even say it's just like a vibration. So don't be scared away by the fact that this device uses very, very tiny needles. So this patient has had the numbing cream on for the appropriate amount of time, and I'm just removing and prepping the skin for the procedure. And honestly, the prep and the numbing takes longer than the actual procedure itself. You can expect to be in the office for about an hour total, from numb to out the door. The next step is cleansing the skin with alcohol. I've had a lot of people ask me why medical grade microneedling is, or how it's different than at home microneedling. And what I always say is that unless you have a way to sterilize your equipment, you are going to be spreading bacteria if you use a home device. Here in the office, each patient, each time they see me, they get a brand new needle that is sterile, stainless steel, and creates just the right amount of damage to tell your body to send help to rebuild the collagen and fibrin in that dermal layer and not create so much damage that we are potentially making new scars with an at-home device. Okay, so now that the skin is clean and numb, I always like to do a test spot. This hyaluronic acid that we have made special for us has zinc and copper in it, and those properties tend to also prevent infection and shield the skin from the outside world while we're doing the procedure. Okay, so the device itself, I can adjust the depth of the needle, and so for the forehead and the nose, I'll be at a much more shallow depth than I will be for the cheeks and under the chin and the neck and wherever else we need to go on the body. So periodically I will be adjusting the depth and watching for a little bit of blood return from the area that I'm treating. That tells me that I'm at the appropriate depth. And then once I've achieved the appropriate depth, then I will continue to treat the entire area and then move on. The device does sound kind kind of like a tattoo gun, or if you've ever had your eyebrows microbladed, it sounds very similar to those devices. Okay, test spot. You okay?
Yes.
So I like to compare microneedling to the process of aerating your lawn. You're creating channels, creating holes, tiny, tiny micro channels into a layer of the skin that we normally cannot reach. Our skin naturally provides a protective barrier between you and the outside world. So when we put any sort of serums on our face, they do not reach the depth that they could reach with the help of microneedling. So this is a wonderful opportunity to get serums in a much deeper layer of the skin to make greater changes a lot faster. So what we do with the microneedling depends on the patient's needs. So if we have hyperpigmented areas, then I can use lifting serums, vitamin C amongst other things, and needle that deep into the skin where we're trying to treat and really help lift that pigment a lot faster than if we were just to put it on top of healthy, intact skin. Another thing that we often use for facials and for hair restoration is PRP, which is platelet-rich plasma. And that process, the only difference is that I would have drawn a little of the patient's blood prior to this part and put it in our centrifuge machine that would separate the red blood cells from the platelets and further separate the platelet-rich plasma from the platelet-poor plasma. And then I would use that platelet-rich plasma, the PRP. At this point, once we've created channels, I would then put the PRP on and then use the microneedling device to plant that into the skin at this point. The nose is an area where people tend to see the effects of their microneedling first, because we all have pores on our nose that tend to collect a little bit more sebum. So this will help to improve the appearance of the pore size. Next, I'll go under your eyes. Typically, we recommend a series of 3 microneedling sessions, somewhere between maybe October and May, when the sun is less of an issue, when you're not traveling to sunny areas, because after the procedure, we really want to protect our skin from those harmful rays. So sunscreen will be your best friend. Some people tend to look very, very red and have a lot of blood splash back during the procedure, and some people don't. Typically, what you can expect is to look pretty red the day of. And until you wash your face, you'll look pretty red and maybe flaky from the product drying on your face. But after that first wash and after you layer on the post-procedure protocol serums, then most people feel like they can go out in public the next day without makeup and just using the serums and tinted mineral sunscreen. But day of, just plan to go home. We do recommend that you don't work out the day that you get your microneedling or after. You can work out before, but don't work out after. Your skin is just very exposed. We have created deep channels to really induce that collagen response, and your skin's damaged and your body senses that and it's coming to the rescue. So this is a time where we really want to protect from infection, and a little swelling is very normal. That's your body's response to come and help heal the area and give us all those lovely benefits. But certainly stay out of the sun for at least 2 weeks after microneedling, and just continue to protect your skin from the sun as you normally would. We created a 4-step post-procedure kit that we give to each patient after their microneedling to ensure that they get the best results from the procedure. So I go over the 4 steps with you and give a card with the instructions at the end of the facial. But I usually start talking about them now. So when you get home, day of, you may feel like your skin is a little hot, like you spent the day in the sun. Sunburn is usually the sensation that people will compare this to the most. So the hyaluronic acid that I'm using during this procedure is actually what you'll use for the rest of this day to not only create a barrier between your skin and the outside world, but to also kind of cool off the skin and provide a little relief. This evening, you will cleanse your skin with a very gentle cleanser that we've created called Rejuvenate. And then you will apply this hyaluronic acid called Saturate. After that, you will let it dry. And after the Saturate dries, then you'll apply a layer of Hydrate, which is a coconut milk moisturizer, which is very soothing. And normally after you do the cleanse and those 2 steps following, the heat and that burning sensation goes away and you're able to sleep comfortably. If you have residual pain or swelling, then I usually recommend trying just a cool compress on the face, a cool washcloth. And if you really need to, then you can take some ibuprofen or a natural anti-inflammatory like turmeric. But the swelling is really what's bringing those helpers, if you will, to the area and healing. And that's what we want. A little inflammation, a little redness. Really just means that we reached a depth to get that good call of collagen to the area where we've strategically damaged. So back to the post-procedure protocol. After you layer on the Hydrate, for tonight, that's all you'll need to do. In the morning, you'll follow those same first 3 steps, but then you'll add a mineral sunscreen that is tinted. Tinted because it's a mineral sunscreen. It's white. And so we tint it to take that white out. And in doing so, it also makes the redness in the face less noticeable. So in the morning, you'll be sure to put on that sunscreen to protect your skin for daytime. And you'll do that for the next 5 days. You will adhere to that post-procedure protocol and no other skincare until after day 5. After day 5, you can resume your normal skincare, but I would wait 2 weeks before you resume any actives, meaning any retinol, retinoids, any vitamin C ascorbic acids, any glycolic acid, anything active in your products. I would wait 2 weeks to use those. Okay, so we're pretty much finished now with the microneedling itself, and I'm gonna go ahead and apply that first layer of hyaluronic acid. How do you feel?
Good.
Does it feel hot?
No.
Kind of tingly or anything?
No.
All right. You can expect your face to shed a layer of skin. After this kind of a facial, about day 2 or 3, up until maybe day 7, you can expect anywhere from light flaking to a nice peel. And you will just want to allow your skin to peel and not to use any sort of exfoliants or to pick the area. Just let it kind of naturally peel until about the 10-day to 2-week mark. At that point, some people find it helpful to get a hydrofacial, which we offer here, to just help to pull away any residual dead skin that didn't flake off on its own and to rehydrate the skin. And also so I can check in with you and reassess how you're loving your results. Okay, so that's the procedure. Any questions?
No, I don't think so.
All right.